Hello everyone, this is Craig McCotter. It's Angela from the EP Clinic. Today we're going to talk about what Holter monitors we have for you here at Wilmington Health. I want to explain a few things about it too. The two basic monitor types we have is basically the MCOT monitors and the Holter monitors. We also have a third type that we don't use that much, which is the event monitor. We'll go through each one and explain them. The Holter monitors, we have various ones. We have ones that last either 1 to 2 days, and the other ones that last anywhere between 3, 7, and 14 days. There's a couple of advantages to a Holter versus an event monitor, and that's one of the things we want to explain. First thing I want to do is show you what a 2-day monitor looks like with the Holter. This is what it is. Angela over here has our model, and so these monitors do have EKG leads, and the unit goes over here with the EKG leads placed on it. It is kind of cumbersome a little bit with the leads, but it actually gives you multiple different leads to look at versus one. Again, this Holter is going to be useful, but it only gives you 24 to 48 hours of data with it. So these are used for people that have, you're trying to find something that occurs on a daily basis, or you're trying to measure how much their heart rate's doing, how slow it's going, how fast it's going, such as people with AFib. The other ones that we have, which is going to be the bread and butter ones that we use most often, is the Holter monitors. These are Holters that last anywhere between 3 days, 7 days, and 14 days. The most common that we're going to tell people to use will be the 14-day monitor. This is going to be everybody who has palpitations, maybe having episodes of blacking out with the syncope, fast heart rates. This will constitute what most people will order. It just be a matter of you order 7 days or 14 days based on the symptom duration that the patient has. So again, this is what either the 3, 7, or 14-day monitor looks like. The one that we're going to most likely would be ordered would be the 7 or 14 days. The other option that we have is the event recorder. This is one that we're going to recommend being the least one ordered. The reason why is event recorders are bulky, they're cumbersome. The amount of data they give you is also very limited. They do not tell you how much burden a person has. They do not tell you how fast their heart rate's going on average. So these things are only used for basically for diagnosing a new condition, such as syncope. If somebody has unexplained syncope, you could use this. But again, because of the bulkiness of it, we would generally recommend a 14-day Holter if as preferred to one of these, because there's more information you get from the Holter versus this. So these are available, but we're going to probably discourage their use because of the lack of data that's given from them and because of the bulkiness of it. But it is something that is offered to patients. The last thing we have, which looks just like the Holter, is something called an MCOT monitor. People get confused with MCOT, and I'm going to talk to you about this in more detail. MCOT is a mobile cardiac outpatient telemetry monitor. It's basically the same thing as a hospital level care monitoring, but at home. So what it actually does is it actually comes with a unit, usually either a phone or a mobile unit that goes with the product, so that they are always connected to a tele monitor as long as they're in phone connection and by the phone. So that if an event occurs, they will get instant notification within reason to what occurred with it. These are very helpful for a lot of things. One, it's called a live monitor. Live monitor being just what it says. The patients in the hospital, they're on live monitors as well. It's the same concept. You're getting hospital monitoring on the mobile outpatient unit. So that works out well for a majority of the patients. These monitors, unfortunately, are the most expensive of the monitors, obviously, because they have a live service attached with them as well. But for a lot of the patients, especially in the cardiology world, this is the one that we order the most of. So again, this is a live monitor. The event monitor is also a live monitor, so that if a major event occurs, it will give notification. But again, because the information that gives you is so limited, we generally don't use these very often. The bulk of the monitors will be the Holter monitors, which again look just like this one. And the amount of data they're going to give you is 7 to 14 days based on the link that you ordered. The other monitors that some people order, again, for the short-term duration, is the 48-hour Holter monitor, which looks like this. And again, pretty basic. It does have the wires, but it's just for a couple of days, and it gives us more data because it gives us more vectors to look at data from. So that's kind of it in a nutshell. With the monitors, people always ask me what conditions are there for. For somebody that has AFib and you're trying to define their AFib burden, the two monitors that we recommend is a 14-day Holter or the MCOT monitor. That will actually give us how much burden they have, their heart rates during AFib, and works out great for there. If somebody has AFib and you're just trying to figure out are they properly rate controlled, then that's generally we order the 24 or 40-hour monitor for that. So for AFib, we're going to either order probably an MCOT or a Holter monitor for that. Doing an event monitor with somebody who has basically no AFib just tells you that they have AFib again. It doesn't tell you any data that's useful for us. Syncope is another one. So syncope is tough. If you think syncope is due to bradycardia, then you could order either a 7 or 14-day Holter. Syncope, because if you think it's due to a possible dangerous arrhythmia, that's when you may order the MCOT monitor. So that's a live monitor. Again, with the Holter monitor, the data that you get will not be processed and sent to the reading doctor until the monitor is finished, downloaded, and processed, and up to be read. So Holters are non-live monitors. So for syncope, you can go with the event monitor, or you could go with the MCOT monitor, and that's also helpful. Or if you think it may be due to bradycardia or some other condition, you can go with the Holter monitor with it. Cryptogenic stroke's another one. So cryptogenic stroke, we have the Holter options because that stuff you don't necessarily need live, but if you had concerns about it, you could order an MCOT, but the 14-day Holter or in the event monitor could be helpful for cryptogenic stroke purposes as well. If you're just trying to assess a person's heart rate, the 48-hour Holter is perfect. If you're trying to assess for palpitations, which is probably the most reason why people order these Holters, the Holter monitor for palpitations is the perfect one, because that way, if they do have palpitations, you could order the 7 or 14-day Holter monitor. Then what we can actually see is, one, how many palpitations they have, two, how much the burden is and how fast their heart rate goes during these palpitations. It helps guide us with therapy. Doing the event monitor for palpitations would show, yes, they do have a PVC or like a PAC, but we don't know anything more than that. We don't know the fact that how much they have it. So for palpitations, we discourage the use of event monitors because of the limited amount of data that it gives us. So that's going to probably be the most common reasons for palpitations, and then the most common monitor we'd recommend for that is probably the 7 to 14-day Holter monitor for it. If you have any other questions, please feel free to give me a call, email me, and I'll answer them. Thank you.